Hello. Um, this is the second lecture for my baba. This one is TLC HEC 10. So, behavioral objectives. Objectives after this session is that the students will be able to identify the difference between goals and objectives, demonstrate the ability to write behavioral objectives accurately and concisely using the four components, distinguish three domains of learning, and develop a teaching plan. Major in 1977 said that the primary educator credited with developing a system for writing behavior. This serves to help teachers make appropriate instructional decisions. This is also used to assist learners in understanding what they need to and are expected to know. Where is he going? How will the person know when he has arrived? Whatever that means. So, planning and conducting the sequence of classes, the educator must decide the following. Number one is formulate objectives. Number two is select and organize content. So, what should be included and what should be left out. Number three, choose the teaching methods and design, and how long will it take to teach the topic. So, there are three more. So, how can learners be kept interested and how to make sure they learn? Number six is choosing instructional materials. And lastly, the evaluation. So, definition of terms first. Goals is also known as the learning outcomes. This is the global and broad statements. General, timeless, and long term. These are also desired outcomes that are achievable in weeks or months. The final outcome of what is achieved at the end of the teaching is called the learning process. Is also attributed to the learning process. So objectives is a behavior describing the performance that learners should be able to exhibit to be considered competent. Specific These are specific, single, and concrete behaviors. Short-term and achievable in one teaching session. So types of objectives is number one, the educational objectives. These are used to identify the intended outcomes of educational process, whether in reference to an aspect of the program or a total program. These are also guide the design of the curriculum units. Number two is the instructional objectives. Describe the teaching activities and resources used to facilitate effective instructions. The behavioral is also known as the learning objectives. These are action oriented and learner centered. Short term outcome focused on the teaching and learning process or learning process. So, behavioral objectives are describe precisely what the learner will be able to do. These are statements of what learners are to be like when they have successfully attained criterion. The criterion. Um, Behavioral objectives are also tied to a criteria, tests, and other measures of successful achievement in the course. So, the difference between goals and objectives. Goals are global while objectives are specific. These goals are broad, objectives are singular. Goals are long term, objectives are short term. Goals are multidimensional, and goal objectives are unidimensional. So, the responsibility in establishing goals and objectives. Setting goals and objectives must be a mutual decision making process between the teacher and the learner. So, both parties must buy into the info and participate in establishing predetermined objectives and learning goals prior to initiating the learning slash teaching process. So, the responsibility in establishing goals and objectives is blending what the learner wants to know and what the teacher has assessed the learner needs to know. This provides for a mutually accountable, respectful, and fulfilling educational experience. So, the importance of behavioral objectives is number one, it keeps teaching on target and learner centered. Number two, it communicates plan to others. Number three, it helps learners understand what is expected of them so they can keep track of their progress. And number 4, selects and organizes educational approach and materials. So number 5 is that it ensures the process is deliberate. Number 6, tailors teaching to learners' needs. This Number 7 creates guidelines for teacher evaluation and documentations. And lastly, number 8, make it easier for the learner to visualize performing the required tasks. So the advantages naman of writing objectives. Number 1, it provides a basis for selection or design of instructional content, methods, and materials. Number 2, it allows for determination as the extent that objectives have been accomplished. Number 3, it provides learner ways to organize their efforts to accomplish their goals. So, guidelines in formulating objectives. Number 1, state the objectives in terms of learner's performance. Begin with a precise verb. Number 2, state objective as a learning product / terminal behavior. So, good with balance of a SKA. Number 3, state only one outcome at a time. Number 4 is objectives should be smart. In writing objectives, or what SMART means is that S is specific, M is measurable, A is achievable, R realistic, and T timely. The elements of behavioral objectives is number 1, performance or behavior. This describes what the learner is expected to be able to do, or the verbs. Activities are visible or invisible. E.g., examples are of visible are write, list, circle, and draw and label certain tasks or activities at hand. And invisible is the ability to identify, recall, and comprehend, and lastly appreciate what needs to be learned. In the elements of behavioral objectives, number 2 is the condition. So it also means under what circumstance. This describes the situation under which behavior will be observed or the performance is expected to occur. The criterion or degree describes how well, with what accuracy, or within what time frame the learner must be able to perform the behavior. Degree is known as the how well or to what extent within what time frame. This is also a standard. The content describes the specific subject matter to be learned. The ABCD rule is a circular rule wherein A, the audience, or other words, who will perform the activity or task. B, behavior, what to do in the certain task. C, the condition or under what circumstance the task should be done in. And the degree, up to what extent was the perform or the activity done. Common mistakes when writing objectives. Number 1, describing what the instructor will do rather than what the learner will do. Number 2, include more than one behavior in a single objective. Number 3, forgetting to include all the elements. And number 4, using performance terms subject to many interpretations and are not action-oriented and difficult to measure. Number 5, writing an unattainable, unrealistic objective. Number 6, writing objectives unrelated to the stated goal. Number 7, cluttering an objective with unnecessary information. Number 8, making an objective too general so that the outcome is not clear. A sample of a well-written objectives is after watching a demonstration on suctioning, the staff nurse will be able to correctly suction a tracheostomy tube using aseptic techniques. Do I need to read these examples? I don't think so, because we already read these, if I remember correctly. Yeah. So, the taxonomy objectives. This is developed by Benjamin Bloom et al. Taxonomy is a mechanism used to categorize things according to how they are related to one another. Behavior is defined according to A, the type of learning domain category, and B, the complexity. So simple to complex. This also pertains to a level of knowledge to be learned. There are three types of learning domains. So cognitive, affective, and psychomotor. The complexity of domain levels is means that the objectives in each domain are classified in a taxonomic form of hierarchy into low, medium, and high. In other words, most simple, moderately difficult, and most complex levels of behavior. There are 6 levels in the cognitive domain. Number 1, knowledge, then comprehension, application, analysis, synthesis, and evaluation. Knowledge is the lowest level. Remember, memorize, recall, define, recognize facts, principles, and terms. The learning outcomes, simple recall of facts or information. Example of verbs for knowledge is choose, cite, count, define, identify, and etc. Comprehension, understanding or appreciation by translating it into a different form, defining/summarizing it into own words. Knowledge is a prerequisite to comprehension. Example of verbs in comprehension are describe, discuss, distinguish, estimate, etc. Application is the use of information learned. Apply ideas, rules, methods, and principles in a specific situation. Example verbs are apply, demonstrate, examine, illustrate, etc. Analysis is the ability to break it down into parts so they can understand the parts well as a whole. Examples of the verbs are analyze, arrange, calculate, classify, etc. Synthesis is also known as creating. So you take the information they know and put together into something new. Examples are assemble, arrange, categorize, and combine, and etc. Lastly, evaluation, which is at the highest level. This judges the value of something by applying a criteria. Examples is appraise, assess, conclude, criticize, and debate, etc. Teaching in a cognitive level. The acquisition of information based on the learner's intellectual abilities and thinking processes. Methods most often used to stimulate learning in the cognitive domain include lectures, group discussions, and one-to-one instruction. Teaching in the cognitive domain. The cognitive domain learning is the traditional focus of most teaching. Cognitive knowledge is an essential prerequisite for learning affective and psychomotor skills. There are 2 types of practice, mass practice and distributed practice. Mass practice is learning information all at once on one day. This is also less effective for remembering facts. A more frequent substitute of words for mass practice is cramming. Distributed practice, however, is learning information over successive periods of time. More effective for remembering facts that last for years. Affective domain is the feelings, emotions, and interests, attitudes, beliefs, values, appreciations. These are very important to nursing practice. Constantly faced with the ethical issues and value conflicts. Nurse value system must coincide with the values of the nursing profession. These can be observed directly but can only be inferred from words and action. This is also where the development of a value system may begin. It is not given adequate weight or importance. So, in affective domain, there are beliefs, which are what individual perceives as reality. Attitudes represents feelings, an object, person, or event. And values are operational beliefs that guides action and ways of living environment. There are also 5 levels in the affective domain. So number 1 is receiving, responding, valuing, organizing, and characterization. Receiving is learner shows awareness of an idea or fact, or consciousness of a situation or event. Well, huwag ka antukin. I'm watching you. I know you're listening. Willingness to willingness to selectively attend to or focus on data received. Examples are accept, admit, ask, attend, focus, etc. Responding, however, is the ability to respond to an experience at first immediately and later willingly and with satisfaction. Agree, answer, conform, discuss, express, etc. Valuing is the learner regard or accept the worth of a theory, idea, or event. This is the willingness and desire to act further that value receiving and responding. Examples are assert, assist, attempt, choose, etc. Organization is the ability to classify, organize, and prioritize values by integrating a new value. Examples are adhere, alter, arrange, combine, defend, etc. Lastly, characterization is the ability of the learner to integrate values into a total philosophy showing firm commitment and consistency of responses. Examples are assert, commit, discriminate, display, etc. Teaching in the affective domain involves an increasing internalization or commitment to feelings. This involves the degree to which feelings or attitudes are incorporated into one's personality or value system. Methods include group discussion, simulation or gaming, role playing, role modeling, and questioning. There are 3 levels of a self. So there is intrapersonal, which is the perception of one's own self. This is where you include self-concept, self-awareness, and self-acceptance. Number 2, interpersonal is the perspective of self in relation to others. And extrapersonal is this perception of others as established groups. Next. Teaching in the affective domain is that nurse educators are encouraged to attend to the needs of the whole person by recognizing that learning is subjective and values driven. More time in teaching needs to focus on exploring and clarifying learners' feelings, emotions, and attitudes. Ouch. The psychomotor domain is acquiring fine and gross motor abilities. Examples are writing, performing procedure, integration of both cognitive and affective. It should be taught separately with cognitive and affective. This is also where you can say practice makes perfect. Repetition leads to perfection and reinforcement. I can't read it. I can't read slide 67. The levels of psychomotor: perception, set, guided response, mechanism, complex overt response, adaptation, and origination. Perception is the ability of the learner to show sensory awareness of the objects or cues associated to be performed. It involves reading directions or observing a process with attention to steps. Examples are attend, choose, describe, detect, etc. Set is the ability of the learner to exhibit readiness to take a particular kind of action as evidenced by or body language favorable to performing a motor act. Examples are attempt, begin, develop, display, etc. Guided response is the ability to exert effort via overt action under the guidance of an instructor to imitate and observe behavior with conscious awareness or of effort. Imitating may be performed hesitantly but with compliance to directions and coaching. Examples are align, arrange, attach, build, change, choose, etc. Mechanism is the ability of the learner to repeatedly perform steps of a desired skill with a certain degree of confidence, indicating mastery or habitual, blended to a meaningful a while and are performed smoothly. Examples are assemble, clean, compile, examine, etc. Complex overt response, the ability of the learner to automatically perform a complex motor act with independence and high degree of skills. This involves economy of effort, smoothness of action, accuracy, and efficiency. Example is discriminate, dismantle, dissect, etc. Adaptation is the ability of the learner to adapt or modify a motor process to suit the individual or various situation, indicating mastery. Example is alter, convert, correct, rearrange, etc. And lastly, origination is the ability of the learner to create new motor acts, such as novel ways of manipulating objects or materials as a result of understanding and developed skill. Examples are arrange, combine, compose, construct, etc. Dave's psychomotor level involves muscular action and neuromuscular coordination. Skill attained can be achieved and refined over time. Accuracy is stressed rather than speed. Imitation is actions. Observed actions are followed. Learner's movement are gross, coordination lacks smoothness, and errors occur. In imitation, time and speed to perform are based on learner's needs. Manipulation is written instructions are followed. The learner's coordinated movements are variable, and accuracy is measured based on the skill of using written procedure as a guide. Time and speed required to perform may vary. Precision is the logical sequence of actions is carried out. The learner movements are coordinated at a higher level. Errors are minimal and relatively minor. Time and speed are required to perform within reasonable expectations. Articulation is the learner's movements are coordinated at a high level and errors are limited. Time and speed required to perform are within reasonable expectations. Naturalization is the sequence of action is known as the sequence of action is automatic. Learner's movements are coordinated at a consistently high level, and errors are almost non-existent. Time and speed required to perform are within realistic and limits, and performance reflects professional competence. Teaching in the psychomotor domain involves acquiring fine and gross motor abilities with increasing complexity of neuromuscular coordination. Methods are the demonstration and return demonstrations, simulation, simulation, gaming, and self-instruction. Videos, audio tapes, models, diagrams, posters are effective in teaching psychomotor. Skill development is very egocentric and requires learner concentration. Asking questions that demand a cognitive or affective response during the psychomotor learning infers with psychomotor performance. The ability to perform skills is not equivalent to learning a skill. Performance is transitory, learning is more permanent. Factors influencing psychomotor skill acquisition. Yeah. The amount of practice required to learn a new skill or new skills varies with the individual, depending upon things such as readiness to learn, motivation to learn, past experience or transfer of learning, health status or illness, physical and or emotional impairments. Factors influencing are environmental stimuli, anxiety level, which may interfere with coordination, steadiness, time, and muscle movement. the developmental stage, and the practice session length. Motor skills should be practiced in the laboratory setting to provide a safe and non-threatening environment for the novice learner. Open skills performance is arranging practice sessions to be done in the clinic or in the clinical or home setting to expose the learner to actual environmental conditions. Mental imaging or mental practice is the use of imagery slash visualizing a skill. Feedback is intrinsic, augmented, and there are two types of feedback pala, intrinsic and augmented. Intrinsic is tell them how they perform, and augmented is convey message by body language. Performance checklists serve as a guide for feedback. The three dimensions of motor skills is number one, gross and fine. Gross involves a whole body or large muscles. Examples are lifting a patient. Fine involves fingers and wrists. Examples are removing sutures. Continuous and discrete. Continuous is the adjustment and corrections to stimuli. Examples are continuous movement of cardiac massage. Discrete is movement in response to an external stimuli. Examples of which is switching off a patient's nurse call. And lastly, number three, closed loop and open loop. Closed loop relies entirely on proprioceptive feedback, so could be performed with eyes closed. Examples is putting on lipstick. Open loop is affected by external stimuli, the painless removal of sutures, reaction of patient, and comfort. Selective attention. Learners must select environmental influences that will assist them in achieving the behavior relevant stimuli, and ignore those that interfere with a specific performance, irrelevant stimuli. Development of teaching plan is predetermined goals and objectives serve as a basis for developing a teaching plan. Mutually agreed upon goals and objectives clarify what the learner is to learn and what the teacher is to teach. Development of teaching plan, blueprint for action to achieve the goal and objectives. So this is also determines the types of domain. The reasons to construct teaching plans is to ensure logical approach to teaching and to keep instruction on target. Learners communicate in writing an action plan for the learners, teacher, and other providers. Serves as a legal document that indicates a plan is in place and the extent of progress towards implementation. The basic elements of a teaching plan include purpose, goal statement, objectives and sub-objectives, content outline, methods of teaching, time allotment, resource for instruction, and evaluation. The basic elements of a teaching plan, so there are a purpose and a goal. Elements of a teaching plan may also include objectives, content outline. Ay, hindi. Binasa ko na pala ito kanina. Yeah. So, yeah. Learning contracts as a written, formal, or verbal, so also known as informal, agreement between the teacher and the learner that delineates specific teaching and learning activities that are to occur within a certain frame of time. Mutual and negotiated agreement. So that is all. Thank you. Baba, I know you'll do great in these finals. Just know that I'm very proud of you. I know I might be sleeping while you're listening to these recordings, but I love you, I miss you, so please don't hesitate to ask me anything, or if you want to rant, please do. Tell me what you're feeling, because I am here and I will listen. Okay? I love you.